So welcome and thank you so much for joining the Hanger Clinic's virtual classroom series designed for medical professionals. So our session today we're hosting the PowerUp series that was started last year. The PowerUp series is designed for women in O&P to discuss topics related to career and personal growth, as well as topics that foster a more inclusive workplace. With the goal of helping to create more inclusive workplaces, today's webinar addresses microaggressions. And honestly, guys, this is the first time that I've actually kind of been introduced to this topic as well. So this was new, and when the PowerUp group brought this to me, it was a really interesting topic, and I think you guys are going to enjoy it. But microaggressions are everyday slights, indignities, put-downs, and insults that members of marginalized groups experience in their day-to-day interactions with individuals who are often unaware that they have engaged in an offensive or demeaning way. They can make a workplace feel uncomfortable, unsafe, and toxic. Our session today will first introduce what microaggressions are, so you guys will get a feel for what that is from Maggie and Kathleen here. We'll also discuss the impact of microaggressions on individuals and the work environment. And finally, we'll bring up a group of panelists that will then join us to share experiences and best practices for addressing them with coworkers and patients. So with that, let's get our panelists up, and I just want to introduce these folks real quick for you all. So first, we've got Maggie Balmer. Let's bring Maggie up to the stage. Maggie is our Hanger Clinic manager out of Springfield, Massachusetts. Maggie is a licensed attorney who currently serves as a clinic manager as well as a certified peer visitor for the Empower program. Maggie will be moderating our panel discussion as well. She has extensive experience with serving in advocacy positions for several healthcare environments and organizations. So thank you so much, Maggie, for joining us today. Appreciate it. Let's bring Kathleen Carroll up to the stage. Yeah. All right, so Kathleen. Kathleen is based out of our clinic manager in Hartford, Connecticut. Kathleen is involved in several O&P professional organizations and serves as the chair of the American Academy of Orthotists and Prosthetists Student Resident Committee and is a regional residency liaison for the National Commission on Orthotic and Prosthetic Education. So thanks so much, Kathleen, for joining us. Oh, these guys are out of the East Coast. Woohoo! Okay, I'm West Coast, so no. Gotta represent. Okay, so next we have Naina Bondry, clinical education. Let's bring Naina up. Hey, Naina. All right, so Naina is the clinical educator for Cascade Orthopedic Supplies. She enjoys learning about new technologies and componentry to assist clinicians in the field. Her clinical focus is on product comparisons and current research to clarify indications and considerations for various designs. So thanks again, Naina, for joining us. Great group so far. And lastly, we've got Robert Salone. Let's bring Robert to the East stage here. Hey, Robert, there you are, West Coast. Yay. He's in our California office here. So really great to see him on the West Coast as well. So he's our clinic manager from Hanger Clinic. Robert has worked as a clinician and a business development manager for Hanger Clinic and currently serves as clinic manager. He is a BOC certified orthotist prosthetist working to help the industry become more inclusive and diverse. I actually met Robert. It was interesting, Robert and Maggie, when I first started at Hanger. So they've helped me learn a little bit about what Hanger means as well. So, so welcome, and hopefully you guys are, thank you so much again for joining us for this session. Really great to see all of you. We will see Robert and Naina back though for the panel discussion. So I'm going to say goodbye, you guys. For now, we'll see you back though, I promise. And then Maggie, we'll see you up in a moment as well. I think you're going to do some of the microaggressions discussion here, and then Kathleen, we're going to start with you. So Maggie, I'll say goodbye, and we'll leave Kathleen up here and get started. So Kathleen, with that, the floor is all yours.
Awesome. Well, thank you all for attending this webinar about microaggressions. I'll go ahead and get started with a little presentation talking about what microaggressions are, common ones that you may have seen or heard but not really realized were a microaggression, and then I'll pass it off to Maggie, who's going to delve in a little bit deeper. So we'll pull up the slide with our definition of a microaggression. So Lily already started out with a great definition of a microaggression, but if you hadn't heard it yet, we've got our dictionary definition here. So we have our verbal and nonverbal behaviors that tend to communicate negative, hostile, and derogatory messages to people rooted in their membership in a particular group. So we're talking about things that are based on race, gender, disability, gender identity, etc. What's key about microaggressions is that they are often unintentional. They might even be something that someone thinks is a compliment, or and we'll see in a few examples from our panelists that that's not necessarily the case. One of the key things in the definition of microaggressions is the term micro. So these are really small situations that maybe by themselves could be blown off or dismissed, but over time they can really build up and have some harmful effects. So they can actually have physical and psychological effects on the person who is the recipient of the microaggression. And this just continues to build up over time. So on the next slide, we'll take a look at a few common examples of microaggressions. Oh, I think they skipped one too many. Oh, all right, well, we can change the order a little bit. I had the different one, but no big deal. So just some information on the prevalence of microaggressions. So they're really, really common. In fact, 73% of women have said that they have experienced at least one type of microaggression, and 59% of men, so even a majority of men. They do tend to occur more for people of color and women just in general. And this can be very common in the workplace. So what we might see is that their judgment may be challenged. They might be overlooked for another position, or have their opinion overlooked. They may have been mistaken for someone else or someone at a more junior level. You know, we've all heard the scenario of a woman being asked to get the coffees for the office, or things like that. So that's the type of thing that we're looking at. So we'll move on to our next slide. All right, so here are some specific examples, and they're really common, so you've likely heard a number of them. So the first example is, when I see you, I don't see color, or you are so articulate. This is usually something that you've heard when someone's speaking to someone of a different race or ethnicity. And frequently these are conversation points that are intended to be a compliment, but actually insinuate that you had different expectations for what that person would have been like. So ultimately, that potentially positive statement can have a harmful effect. The next one is one I think is very, very common, especially in the workplace, where we tend to have office administrators that are women. And so it's easy to call them the girls up front or the ladies up front. And so over time, that can build up and really kind of have a more, place them in a more diminutive role rather than considering people as equals. You might also hear someone refer to a person as, oh, she's crazy. Same sort of thing. You know, if someone's being emotional or, you know, being a little bit more assertive, it's a common phrase to say, but over time, that repetitiveness can really dig deep and be harmful for that work environment. The last example here is definitely relevant for our work within Hanger Clinic, because we frequently work with people with physical limitations. And so the last phrases are things like, the way you've overcome your disability is so inspiring, or good for you for going out in public. Both of these, again, seem like they are words of encouragement or a compliment, but they also indicate that maybe you had the assumption that that person shouldn't be doing the things that they're doing or the activities that they're doing. So again, masked by thinking that it's a positive, but really can have harmful effects. So later on in the presentation, Maggie's going to talk more specifically on how to address microaggressions in the workplace. But a good start is that if you are giving someone praise or a compliment, or even just referring to that, focus on their professional capabilities. A true compliment doesn't really need any extra qualifiers. It should be just based on what they're actually achieving. All right. So we will move on now, and we'll have Maggie take a step in, and she'll talk about how to address this in the workplace.
Okay, thank you, Kathleen. Everybody can see me now, I guess. Yeah, thank you so much. So as Kathleen said, she gave a great definition of microaggressions and some examples. And if we go to the next slide, we're just going to delve a little bit deeper into what that might look like in the workplace and why we're actually concerned with this, why we're talking about it in the first place. So I think the real issue here is about inclusivity. We want to create a culture where every team member feels valued and respected, supported, and heard. And maybe you're a part of a team that already feels like that, and that's wonderful. But maybe you're part of a team that has some room to grow. So we just want to talk about some ways to address these issues in the workplace. So one thing you might look out for, just as social cues to see if there might be an issue within your office or on your team, is to just be observant of people's body language. So for example, if somebody's avoiding eye contact with a certain person, or maybe they used to speak up more in conversation, they used to be more engaged in the team discussions, and now they're becoming quieter. Those might be warning signs to look out for, to think, I wonder what's going on with that person. Maybe there's something about the group dynamic that isn't working at the moment, or that could be worked on. Another example is somebody kind of taking more personal space between themselves and another person. Of course, currently with COVID, we all should be taking 6 feet of space, I hope, in our various offices and in social situations. But in normal, in different circumstances, when we're not necessarily practicing social distancing, that might be an indicator of some issue that's going on underlying the surface. So the next slide, please, Lily. So just kind of building upon that in terms of observing office dynamics, you might want to think about the research as well. And so there is research to show that actually when women in particular speak up in groups, they're more likely to be interrupted, challenged, or dismissed when they do. And so Kathleen kind of alluded to that already. And if that behavior, or if that circumstance is repeated over time, it could really lead to a change in the culture, or just a decrease in morale for the group, not only for the women in the group, but for other people on the team as well. And this not only affects women, there could be other groups that are not in the dominant group of the team that might experience a similar scenario. So especially as managers, we just want to be kind of observant of that, keeping our eye out for these types of dynamics and whether they're taking place. And as Kathleen mentioned, we really want to be careful of our language and not refer to people as crazy or too sensitive or assertive or aggressive, rather, if they do point out a microaggression. Assertive is different than aggressive. Assertive would be bringing it up in a productive way, but aggressive would be more of like a name-calling scenario. If somebody said, what you said offended me, and we call them aggressive, that might be an example of invalidating someone's feelings and making them feel like their experience isn't real. So I think overall, when we're talking about microaggressions, what we're talking about is interrupting a dominant culture or behaviors that exclude people or make their feelings and their points of view not valued and not respected. So by calling someone too sensitive or crazy, that acts to invalidate their point of view. So if you do observe this happening on your team, especially as managers and in leadership, we want to make a plan to address the issue and also to support and enable dialogue around it. So it's not always comfortable to have these conversations as a group, but one way to start might be to sit with your team and outline a list of core values that your team shares, and then the whole team could agree upon together. And then, actions that you want to take to support those core values. So maybe it could be things like, we don't interrupt people when they're speaking. We always greet each other in the morning. Whatever you and your team decide would be the right approach to that. So next slide, please, Lily. The last slide we're going to review before we move on to the panel discussion is just to outline some actions to take and some examples that we as individuals can embody and also that leadership can embody in order to facilitate these types of changes if there is a change that needs to be made on your team. So one thing that can happen is if you're confronted by somebody who said, you said something that offended me, I think it's natural for all of us as human beings to sort of get into that fight or flight mode. Maybe we get a rush of adrenaline. We're feeling like, I don't want to be in this situation. And we might feel sad. We might feel angry. We might feel defensive. And so the first thing we could do if that does arise is to just take a moment to take a deep breath and pause. Because when we slow down that biological response, then we're less likely to kind of just spew out something defensive, less likely to engage in that kind of name-calling behavior, and more likely to facilitate a more productive discussion. I think another point, and the second bullet point here on the left-hand side of what we all can do is listen and follow the lead of the person that's bringing this issue to your attention. So, you might feel like you want to sort of take over the conversation and explain yourself and dominate the interaction with this person because it's so uncomfortable. But a better approach would be to just listen to what they have to say and kind of follow their lead on how long they want the conversation to go on for, and what they want the outcome to be. And along with that, I think it's important to keep in mind that we can all own our mistakes and apologize for them, even if we didn't intend to offend somebody. So when we're thinking about this, I think it's important to remember that committing, so to speak, a microaggression or saying something offensive to somebody else doesn't make you a bad person. All of us most likely have done this at one point or another. We all have biases. So it's really about interrupting the behavior and separating it from your value as a person. So rather than thinking, oh my gosh, I can't believe I did that, it's so horrible, it's more like, okay, this is what happened. I'm going to pause, take in some feedback about it, and hopefully learn from it so that we can move on and have a more productive relationship. So it is important to apologize, even if your intention was not to offend. And I think along with that, we can just try to adopt a spirit of humility, keeping in mind that, again, it's not about our character, it's more about a learning experience. If we stay humble and ask for feedback, we're more likely to gain from the situation. And when it's appropriate, especially as managers, we could initiate team discussions with the group. Let's say an incident happened in front of the entire team. That might be a scenario where you could facilitate a team discussion as a manager. If it happened, one person and another person kind of separately, one-on-one, then I wouldn't think that we'd want to necessarily bring it up to the whole team because that was a private discussion between two people. But again, you could go back to relying on core values of the team, principles and group dynamics that you value as a group in your office. And then, of course, if it gets to the point where, let's say, a certain individual continues to act inappropriately or say certain things that you've asked them not to say repeatedly, and they're, you know, more of an aggressive nature, then you do want to report it up the chain to your management and possibly to HR. So on the right side of the slide, I'll just quickly go through these before we get into the panel discussion. As leaders, we can always model appropriate behavior. I think many of us who are in leadership positions have already heard that phrasing and embody that in various aspects in terms of managing our teams. So the same goes for language and behavior and inclusivity. If we model appropriate group dynamics and appropriate ways of communicating with our team, then the team is going to follow that. And I think it's also important to convey a sense of urgency when we do address microaggressions and when they do take place in our office. As Kathleen mentioned, because these incidents can seem rather small, it's easy for both parties, both the person saying the offensive term and the person on the receiving end, to just say, that wasn't that big of a deal, we'll just let it go. But the problem with that is then it just keeps happening over and over again. And as Kathleen mentioned, that repeated nature of the microaggression is what leads to a more toxic culture. So one thing we might think about, let's say if we're starting today from ground zero as a manager and you think that maybe my team needs, maybe the office dynamics and the culture in my office needs to change a bit, you could start with taking a survey about how your employees feel like things are going currently and what things could be going better, and then come up with a plan to address those issues. And then down the line, let's say 6 months later, reassess and see how that's changed, if it has in fact changed. So I think that with that, we can move on, Lily, to the next slide, which I believe is our poll question. Yeah. So I'm interested, I've been talking for a while now, so I'd be interested to hear from you all about your experiences with microaggressions. So the poll is, how many of you have experienced a microaggression? And there will be a window popping up on your screen with some options. Let me get that up for you, Maggie. Give me 1 second. All right, we're going to launch that poll for you. Great. All right, everyone. There you go. Yeah, so you can see up on your screen, you can select one of the answers, either yes, no, or maybe I'm not sure. And we'll give you a minute to fill that out and submit. Great, we're getting close to almost 80% voted, getting there. Great. Okay, let's go ahead and close that poll for us. Thank you all so much for inputting that, and I'll show the results for you, Maggie. Here you are. Great. Okay, so yeah, it's interesting to see the results, and it seems like they're pretty reflective of the slide Kathleen had up before. So 81% of you have said, yes, I've experienced a microaggression. Only 5% said, no, I have not. And 14% said, maybe, I'm not quite sure. So we'll get into some more examples. I think that's an interesting, I like having that third answer there as an option because it's good for conversation, to facilitate the conversation moving forward. So with that, Lily, I think we'll go to the next piece, which is hearing from our panelists. So maybe we could bring back up our panelists. All right, so let's bring up Kathleen, Naina, hey, and then Robert. Perfect. And remember to unmute in case you guys are muted, but you should be good to go, Maggie. Great. So it's good to see you all again. Thanks again for participating in this panel. And so I'd love to hear from you all about what microaggressions you personally have experienced, or maybe that you've observed personally. So I think, Naina, we'll start with you, if you wouldn't mind sharing some of your experience.
Yeah, absolutely. Thanks, Maggie. So there's a couple that I encounter pretty regularly. The first is asking, where are you from, with the clear intent of figuring out what race I am. The second is asking or wondering, saying, you must like spicy food, making that assumption about where I'm from, what I like to eat, although it's absolutely true in this case. And then also just if I introduce myself saying, oh, I know someone who's Indian, or I have an Indian neighbor, that makes it very challenging for me to want to connect on that level with someone I've just met. So those are three that I've experienced pretty regularly.
Great. Thank you so much, Naina, for sharing that. And Robert, I'm going to switch over to you. You've had some experience with this as well in the clinic and with patients.
Absolutely. Thank you for the question, Maggie. I can think of two examples that I'd like to share. The first one was with a patient in clinic that was frustrated about wearing a mask and the social environment surrounding Black Lives Matter. He stated that he didn't believe in masks and that Black Lives Matter was taking over the country. So that was the first example that I experienced. The second was more of an observation. And this was where I was a participant in an affinity group called Pause. The members consisted of 9 minorities and 1 white. And the group was referring to the 1 white participant as an ally. And for me, it just seemed a little exclusionary, although I know that that's a popular term currently.
Yeah, thank you, Robert, for sharing those examples. Could you tell us a little bit about how you address those situations and how they make you feel?
Yeah, sure. So in the first situation, I responded to the patient. Obviously, that his opinion mattered. And then I really redirected and focused back on the service that he was in the clinic for. Just really trying to de-escalate the situation and focus on the professionalism. So that was the first situation. In the second situation, it was more of a conversation with the group lead. And there I just said, as the 1 white participant, the action of them joining the group was evidence enough for them to be included, and that we might want to rethink separating that participant out from the rest of the team.
Yeah, thank you. That's really interesting feedback. And could you just say a little bit, like, how did it make you feel when that patient made that statement to you about Black Lives Matter?
Well, it's interesting because, I typically will stay professional in that environment. And, when things like that come up, I really do just try and de-escalate and listen to what the patients have to say, because sometimes they just need a sounding board. And then we can refocus and get back to the patient care. Yeah.
Thank you so much. Yeah. And Naina, it sounds like you had a similar kind of approach to dealing with those kinds of comments.
Yeah, I would agree with Robert. I tend to use a similar tactic, de-escalation, deflecting, really trying to focus on the task at hand, and just doing my best perhaps to, quickly acknowledge and politely acknowledge what they're saying, and then saying, hey, why don't we, talk about the conference we're at, or, try to change the topic, and that also helps to kind of diffuse the situation.
Great, thank you both. So that was a really good example of, approaching microaggressions with patients. And I think, Kathleen, you also have some experience with that and some insight into how to deal with those. Could you speak to that a little bit?
Oh, there you go. All right. Yeah, absolutely. And one of the things that we've talked about in the presentation leading up to this is how to deal with microaggressions in the workplace, maybe between staff members, but we are also people who work closely with patients frequently. And so like Robert and Naina said, you have to deal with the feedback and the comments that are made by them. So kind of one scenario that is I've heard a lot of stories about and have had some limited personal experience with typically male patients making comments about seeing a female clinician, and may have some kind of sexual undertone, may not be explicit harassment, but still enough to make you feel uneasy in the room. I know that for me as a resident, anytime something like that would come up, I was fortunate to have really strong mentors who wouldn't really tolerate that sort of behavior and just say, hey, those comments are inappropriate, and then left it at that. But I've also heard of scenarios where even that sort of comment didn't go over well, and potentially even leading to the patient being dismissed from the practice as a patient. But that's, again, that's escalating beyond a microaggression there.
Mm-hmm. Yeah, that it sounds like that was beyond. And I think microaggressions, you know, there could be this continuum of aggressive behavior, and so maybe microaggression is on, you know, the lower end, but then things ramp up more towards harassment, like you were saying. Yeah, does Robert or Naina, do you have anything to add? Maybe I'll start with Robert about, just as a follow-up to what Kathleen said, and maybe anything different and how you would deal with it between a patient, you know, feeling a microaggression from a patient as opposed to one of your colleagues. Do you have a perspective on that?
Yes, I'll share. So I think when dealing with a patient, it's important to empathize with that patient. You know, we have to refocus and realize that the patient is in our clinic for a specific service, and, you know, they may be dealing with all the societal pressures as we all are. And sometimes they just need a sounding board. And then, like I said, you can refocus and get back to what they're there for.
Yeah. Would you approach it maybe slightly differently with a colleague?
Yeah, you know, with a colleague, you know, we're in a professional environment, and, you know, there you can use that as a training tool, or you can use it as, you know, let's communicate as to why, you know, you're speaking this way or you're feeling this way, and kind of put it out on the table so that we're not assuming what that person is saying, really just kind of demystifying and clarifying what they're saying.
Yeah, great. Thank you. I love bringing in that word assume, because I think there's a lot of assumptions on this whole topic, you know, so thank you for that. And yeah, Naina, did you have anything to add about maybe the difference between colleagues and patients?
One thing I like to remind myself when working with patients is they're often, you know, in an uncomfortable situation perhaps for them. So they're just trying to connect with us, and that maybe doesn't come across the right way all the time. But I know that I've been fortunate enough to not feel negativity rather from those remarks, and just curiosity and really wanting to get to know me. So I let the patient comments slide a lot more, and I've never said anything to a patient. They've also been very microaggressions, I would say. Mm-hmm. Compared to a coworker, I've been very fortunate to work at two companies that there's a very open environment, so I could say very gently, hey, would you mind not saying that? I'd be happy to talk to you about X, Y, and Z, or maybe they're just curious about culture, and I think that would be taken very well. So definitely back to your point about having a culture where that kind of discussion is appreciated and encouraged.
Yeah, thank you so much. Yeah, and so just to sum up, it kind of sounds like the approach generally that the three of you take with patients is deflection and reframing and refocusing on their care in the office, unless, you know, it gets to a certain level where something more serious needs to happen. And then with colleagues, you know, it's really about just having more of an open dialogue and saying, not making assumptions, but letting them know, you know, gently that that was a little bit offensive. I'd prefer you not use that particular term.
Absolutely.
Okay. So yeah, on a more personal level, let's we talked a little bit in the training leading up to this about pop culture, and again, that word assumptions and questions that people might ask, and just trying to maybe bond with you in the office. I think this is more geared towards colleagues. And so, Naina, could you start us off maybe just giving an example of some of the things you've experienced on your team?
For sure. And even outside the office, this just happens in social settings and just in life, I suppose. So, you know, we've all had a very different childhood and upbringing, and people are often surprised that I haven't had the same upbringing as them. So in one way, it's very nice and inclusive that they see me as an American citizen and think, okay, all Americans have watched A Christmas Story and they've all seen Star Wars and they've done, you know, these things that we see are very American. But I had a very different upbringing. And so I watched a ton of movies, and maybe I saw Bollywood movies, and maybe I did different activities than you did. So there's always, oh, really, you didn't do that growing up, or your mom didn't make you this? And I said, no, but I have delicious Indian food. So it's just an interesting, it's an interesting way that people want to, again, connect with you, but just being mindful that everyone comes from a different place. And even if you are from the same race or ethnicity, your experiences will still be very different.
Yeah, that's a really good point. I think a lot of us have ideas about, certain pop culture references that everybody must know, and it's just not really the case. I've certainly had friends of mine who didn't have the same experiences as me in terms of that, and it could be a really interesting learning experience. I know in my office, for example, there's a couple of my male colleagues and I all really like Seinfeld, and so sometimes we'll make jokes about Seinfeld and we'll be talking about an episode. And we also know that our other colleague has never seen the show and doesn't really know what it is. And so recently we were doing this and I could just feel, I'm like, oh, she's not knowing what we're talking about. And we're having this conversation with her in the room. She's not really a part of it. And so I was like, this is what we're talking about. This is why we think it's funny, just to make sure that everybody was sort of included in the conversation as best we could. And, that's just little things like that. Isn't necessarily, a microaggression per se, but it's just an idea about being inclusive in the team. And so I'm going to switch gears now to talk about maybe when we actually ourselves maybe have committed a microaggression or have witnessed somebody on our team doing it, and just some feedback to the group about how to handle it when you feel like maybe you're the person that said something offensive. So Naina, I'm going to start with you and just see if you could give us some feedback about that.
I have a way to potentially not handle it, which I am not super proud of, but I have definitely learned from. When I was working with patients, I can't even remember the exact comment I made, but it was definitely some assumption about her marital status because she had children, something like that. And I just made a comment, and I remember the look on her face, and I remember feeling just rotten and terrible. And then I resolved, okay, I'm not going to make these kind of comments. What was my intention in asking that? Is it related to the task at hand? How can I better focus on work? And I think I've been pretty good ever since. Perhaps I should have said something, but at the time I was so kind of distraught that I had said that. I just made a note that I'm going to improve. So if that's the way to handle it, that's great, because you're still making a positive change.
Right, yes. And because these interactions are so everyday and so common, I think it would be difficult to address every single one every time. So yeah, I think I appreciate that feedback. I know I've been in the same position as you, so thanks for sharing that with us. And then, Robert, you had some feedback on this piece as well. Do you want to share about maybe committing a microaggression, or what you think would be a good way to move forward if that happens?
Yeah, so I definitely am guilty of committing a microaggression. And I think once it happens, you have to really reflect and sit down with that person and apologize and just say, hey, you know what I said or the way that I expressed it was a little insensitive, and I'd like to learn and move forward. And I think when you can humble yourself in that situation, you can move forward. I don't pretend that I always do things right. And I think the thing that can sometimes bring us together is that we all are human, and that emotions get, the best of us sometimes, and we commit those microaggressions. But, tabling back and finding a common place can really help us move forward. So.
Yeah, thank you for saying that. I think that's spot on. And again, kind of relates back to what we were saying before in the slide portion of the presentation, that we're all human beings. We all have biases. We can assume probably that we've committed a microaggression at some point. And so the goal is, progress, not perfection. We just want to make people aware of, those possibilities. So thank you. Kathleen, are you there? I see you're on the phone, so I'm not sure if she can hear us.
Can you hear me?
Yes.
Yes.
Okay, perfect. My webcam was freezing up, so I joined via phone call, so I can hear you guys. And I don't have my headphones. So old-fashioned.
No worries.
But yes, I can hear you guys. Is it my turn to share about microaggressions in the workplace, or if we've committed one?
Yes,
perfect.
Please.
All right. Sorry about that. Yeah, so I think just kind of recapping a little bit about what Naina and Robert both said, but one of the key things when having committed a microaggression is owning up to it and learning from the experience. Like Naina mentioned, it might not be comfortable or available for you to do something at the moment, but you can always learn from it. And then another strategy is if you find it something that you're saying repeatedly. So for example, if you tend to say girls or ladies in the front office, maybe come up with a different strategy for how you handle that situation. So kind of retraining how your brain thinks about that. Maybe you start calling everyone by their name rather than by their gender. You can say, oh, the office administrators or our billing experts, or such and such is more knowledgeable about XYZ, and use actual physical names. And that's just one scenario, but there's lots of different cases where you might find yourself repeating the same comments, and you might need to reflect on why you're saying that and what you can do instead.
Great, thank you. Yeah, I really appreciate that input too. And I know I'm going to call myself out that I tend to say you guys a lot. I think it's a New England thing, but it's so in there. It's so hard for me not to say you guys. And not everyone's a guy. So if I'm addressing a group of people that has both men and women in it, and I say you guys every time, I'm like, oh man, I'm going to try to say something different. I want to say y'all, but I don't feel cool enough to do that. So that's something that I'm working on too. So if any of you hear me say you guys, feel free to call me out on it. But thank you for that feedback, Kathleen. And also you had mentioned a good example too about how sometimes we correlate people with physical disability with those that have also having cognitive disability, and that that's not the right or necessarily a fair correlation to make. Could you speak to that a little bit?
Yeah, absolutely. So I mean, I work predominantly in a pediatric setting, but this kind of applies across the board. It's easy to see people with significant physical impairment as not necessarily being cognizant of what's going on or what's happening. And that's frequently not the case. It's just an assumption that we're kind of trained to make in some scenarios. And so just really emphasizing the importance of acknowledging the person in the room. If they're your patient, they are in fact the most important person in the room, and should just focusing on speaking to your patient as you would any other person. You might still need to rely on a caregiver or someone accompanying them to help get the responses you need, but that doesn't mean you don't ask the questions. And I think the same holds true for children as well. You might still need their parents' feedback, but it's important that they're treated as important people in that appointment, and that their voices are heard, and that they're giving consent when they can. And because they will take that feedback if every time they're kind of bypassed every time that they're in that patient appointment.
Right. So yeah, giving them some agency, because it is their healthcare ultimately.
Absolutely.
Great. So I think I'm going to wrap up and kind of summarize so we can get to have a couple other questions, and then hopefully some audience Q&A as well. So one thing I just wanted to say in wrapping up is acknowledging to you, the panelists and people on the phone, that what we're talking about is a bit sensitive, and also is an ask. It is an ask to kind of gain a level of awareness and potentially make behavioral changes, make maybe some internal changes about the way you think about things. And so that is, we're all adults and in control of our own lives. We don't necessarily like being told, hey, you need to make a change, or being told what to do in a sense. And so I recognize that what we're talking about, it is an ask of people to take a step back and maybe think about making a change potentially. But ultimately, the goal is to make our culture, whether that's in the office, in our company in general, or, society at large, really, to make it a more inclusive place for everybody. And when we do that, our teams are more efficient, more productive, less likely to have poor morale and that toxicity in the group, which only makes things more positive for our patients, more positive outcomes for our patients and for our staff, and ultimately for the business. So that's the goal of the whole conversation, and I hope that people took that away from what we've said so far. And I think with that, I'll hand it back to you, Lily.
Great, thank you so much, Maggie. Yeah, and we have some time for questions, so I've got a few here that I think we'll run by you all and see if we can get some more insight there. One thing I want to mention too, Maggie, that you guys, that's something I say quite a bit, even on the virtual classroom. So these folks that have been attending the last few know me well. So being from Texas, so I can go and pass off the y'all. So
yeah, you can do the y'all. You should get into the y'all. I just feel like I'm a poser if I do that.
No, it'll work. It works. All right, everyone. So, okay, I've got one here. The question I wrestle with after being on the receiving end of a microaggression is, am I being overly sensitive? In my experience with the way these comments are said, I'm pretty certain they are not ill-intended. Do any of the panelists have asked themselves the same question? So am I being overly sensitive? Do you guys ever ask yourself that question?
I think Kathleen was going to speak to that. Yeah, Kathleen?
Yeah. So I like this question a lot. I am definitely an overthinker myself. So I have a tendency to say, "Oh, should I have brought that up? Am I making, a situation worse?" And, this person probably didn't have any ill intent in mind, and so was it worth it? But I think ultimately it's really important to own up to your own emotions. The fact that someone said something and then you didn't feel great by that comment, that's worth bringing up just in and of itself. And you might find out that the person who, made the comment or didn't even have any idea that what they were saying was harmful. And you can't expect any sort of resolution if they don't even know that there was a problem in the first place. So I think absolutely, try to steer yourself away from that overthinking or feeling like you're being too sensitive. The fact is you did feel hurt in some sort of way, or did feel uncomfortable, and that's worth speaking up about.
Great. Thank you so much, Kathleen. Here's another one. Any advice for those who may second guess themselves after pointing out a microaggression, particularly in a work setting? I find myself asking, did that sound professional? Did I make matters worse? And I'm wondering, Robert, would you be able to speak to that one for us?
Yeah, sure. Great question. I think that for those second guessing themselves, when you open up the lines of communication to discuss some of those sensitive topics, that really takes courage. And when you do that, both parties can address it with mutual respect and listening to what the others have to say. I think when you do that, you start to get in that mode of empathizing, and that'll de-escalate what that situation is. And rather than not communicating, to start making assumptions. So I think when you put it on the table, you empathize, you can de-escalate it, and there's no assumptions. I don't have to walk around the office wondering what you said. We hashed it out and we're clear.
Great, thank you so much. That's
terrific. I think, we do have time for, one more maybe. This one's about online microaggressions. So I'm wondering, Naina, if you could take this one. What advice do you have for dealing with microaggressions online?
Sure, I'd be happy to talk about that. I would personally say it's generally not worth it. I think it is challenging to have a productive conversation online, and if you're feeling pretty gung-ho and ready to right the world, you can certainly chime in, but be ready for the comments that follow, both in support of you and against. So just make sure you have the emotional energy for that. I know I certainly don't, so kind of gauge where you are there. But remember, people that make these types of comments are generally just trying to stir the pot. So just keep that in mind.
Great. Thanks so much, Naina. I was looking to see what other questions have come through. There's so many. I don't know how to choose for you guys. Let's see. This one's an interesting one. Maggie, I wonder if you can take this one. Let's see. How do you address microaggressions from people in leadership positions, people in power positions? How would you address those?
Yeah, that's a really good question. I think one thing you could do is find an ally in a leadership position. So if you're not comfortable raising it directly with that person who's in power, whether that's your direct manager or not, potentially finding somebody else in a leadership role, either on the same level as that person or maybe potentially higher than that person that you do feel comfortable with to discuss it. And then you might start by keeping, if you know, depending on your comfort level, keeping the person's name out of it and just saying, hey, this is something I've noticed, a behavior or comment I've noticed leadership say or exhibit, and I do find it offensive. I'd really like for that to change. What do you suggest that I do? And see what kind of response you get from that person. And I think if you don't have a person in leadership that you feel comfortable talking to in that way, if you're a hanger person, you know, you could probably reach out to Lisa Liu. Sorry to put you on the spot there, Lisa, but she's our diversity and inclusion officer, and I'm sure she'd be happy to help direct people about those types of questions. And if you're not a hanger employee, potentially you have somebody like that in your company who might be able to direct you.
Great. Thank you so much, Maggie. Here's another interesting one. I know we only have a few more minutes, but maybe this is our last one, but I really liked this one because you guys did speak to it a bit earlier. When is it okay to ask from a genuine desire to get to know someone versus the where are you from question? You know, I think you mentioned it earlier, Naina. I get the same thing too. Honestly, I've always gotten it since, you know, when I moved to the West Coast specifically, I got it constantly. Where are you from? It's interesting to know that. So I'm interested on that too. You know, when is it okay to ask that from a genuine desire to get to know someone?
That is a very interesting question. I'm trying to figure out the right answer. I actually do other people a favor and bring up that I'm Indian so that we open the door for that discussion. I know most people don't do that. I think when you're with friends or in a social setting, it is easier to bring up that topic, but also thinking about your intent. Why is that important to you? Why does that matter? Have you been to that country and you think they're from there? I would say really examine your intent. If it's just because you're curious or on the negative side, kind of nosy and just need to know, or you want to know if your guess is correct, perhaps table that for later. But if you have a discussion that's a little bit more productive, I would say that there's a better way to say it. And I wish I had those words to give to you, but I don't know what those are either.
I think you bring up a good point though, Naina, that like as you get to know someone, whether that's in your personal life or a colleague, you know, let's say you're in the office with someone every day pretty much, most likely that will naturally come up at some point. And if it doesn't, that probably means that that person doesn't want to talk about it. And so it's better, I would think, to not ask.
Right, then that was a great response, you two, and that really helped me to kind of understand maybe even the reason why someone is asking that. from their perspective as well. So thank you both. All right, so I think we're going to close out the session because it's been a great one. We're at the hour. Let's share my screen here too. That way you guys can get a nice picture if you want of our panelists with the power up at the bottom. You can take a snapshot. I'm just kidding. But it's been great. It's been a really great discussion here with you all. Thank you again so much for joining the session. I really do appreciate your time, your energy, your effort towards this topic specifically. As a reminder for everyone else, thank you all, our learners, for joining. I know that you're taking time out of your day on a beautiful summer day as well to be here with us. So thank you all so much for joining us. And any last comments or anything you want to say, Maggie, to close out the session for us?
Just thank you again to everybody for participating. I had a lot of fun doing this. I hope you guys did too. And yeah, be open to questions if people want to email me or message me offline too. So thank you.
Great. Thank you so much, everyone. Robert, Maggie, Nina, Kathleen. Again, bye for now, everyone. We'll see you all next time in the virtual classroom. Bye now.